Terry, Marcus, Claire, Frankie, and Jennifer. How are you doing tonight?
Yeah, we're good.
We're doing great.
We're so happy to be here. And when you were talking about community, it really made me think. I mean, Penn School of Nursing is committed to community and has a lot of community engagements, but we have new communities all the time. And We the People stage is a new community. Philly Counts 2020 is a new community. And what happens when we're engaged in new communities is it makes us better nurses. And being engaged with the census and really thinking about the census has made us better nurses. And we're also here to share our stories. This is, as you said, an incredibly challenging, difficult time, and we're all together. So I'm here with the students from Penn Nursing and my colleagues from the Hospital of University of Pennsylvania, and we are just grateful that we're part of this. I was thinking today about a story, and I was thinking about, I'm a nurse practitioner. I work with children with diabetes, and yesterday I got a call from a child who was home alone. Her 10 years old, her mother was at work. She works in a nursing home. Her grandmother, who usually watches her, can't come to the home because the mother's afraid she's going to infect the grandmother. So this is a 10-year-old child with diabetes who's home alone, taking insulin, checking her blood sugar. She's home with a 12-year-old brother, but essentially she's home alone. And she FaceTimes with her mother and her grandmother every time she has to take a shot. And she called me because she couldn't find her mom, and she was crying and she was anxious. And while I was talking to her, her mother called her back. And it made me think about how much anxiety there is at this time and how difficult and isolating it can be. And we all have some similar stories. Some of our stories are personal, some are professional, but we're here to share and we're here to be part of the community. And Marcus, I know you've had a really challenging time in the past couple of months, and you've been really generous about sharing what you've been through and how that's kind of impacted you as a nurse.
Yeah, thank you, Terry. Like Terry said, I'm a nurse. I practice as a child and adolescent psychiatric and behavioral health nurse here in the city. Born and raised Philadelphia native, so I am so fortunate to have the opportunity to provide care back to the community that I was raised in. I've had a very personal experience. I actually tested positive for COVID very early on when everything started, happening. I was in California in the beginning of March, and then that's when the cruise docked in San Francisco, and that's really when the nursing home in Washington started, and that was like, oh, this is coming. This is going to hit us by storm. And I remember shortly after that, I began developing symptoms and called my doctor, got tested at a testing site, and lo and behold, I tested positive. And I remember my first feelings were just of guilt. The guilt that I was not on the front lines. I wasn't with my colleagues during the beginning of this and experiencing that with them, to support them, to have them support me. And I remember just feeling this immense guilt. And I think on top of that, fortunately, I was able to take care of myself at home. But I also had the advantage of being a nurse, knowing to take 10 deep breaths an hour to prevent complications with, my lungs and breathing and things like that. And it made me think about the people that don't have that knowledge, who don't know when their blood oxygen levels might be low by, using a stethoscope to listen to their lungs. And it made me just starting to think about, and then you see on the news that all these people are getting sick, going to the hospital, and, the sense of community is gone because everything's shut down. Everything goes to virtual. And as someone who has experienced anxiety and depression before, I felt that coming on because I didn't know what was going to happen. One day I could go to sleep and be fine, and the next day I could wake up and not breathe. So I remember just being, starting to get that intense anxiety. And then, it was my family, it was my friends, it was my nursing family that really was my support system. And the way that I got over my guilt, if you will, was participating in advocacy efforts just to make sure that nurses and other healthcare providers and essential workers and the public just had what they needed, the information they needed to get through this together. And then, for my patients, I think, they don't get visits. They don't see their family. I work in an inpatient environment where some outpatient caseworkers and therapists and things come in, and that's no longer. So we as the nurses are playing a lot of different roles, not just the nurse. We're, being that all those other support systems that people normally would have. So it's been interesting when it's a field that relies heavily on in-person interaction.
Right.
So now we're seeing more patients having acute mental health episodes because they can't go to the clinic. They can't see their therapist. Their family-based home visit worker can't come to the house. Parents have to go to work and kids are home alone, like Terry talked about. So you begin starting not only to take on your own burden, but then the burden of the people you're caring for, because you're trying to be that in place of what they're missing.
I'm curious. I mean, there's so, as you said, such a complex series of challenges that we face as a community, and definitely you as healthcare providers. So I'm wondering if any of the other nurses that are on.
I actually want to touch base on that because when I heard you talking, Marcus, you felt the first word that you said was guilt. And I remember that feeling so vividly because I also got very sick. So I'm an ER nurse, and I remember walking my first shift before, as we started the conversations of how we're going to see patients and preparing, and we weren't even doing testing at that time. So this was my first shift walking into work where we were going to do that. And I remember picking up hours that week and feeling like, this is the time I'm being called and it's my duty to work and to provide for my community. And that very first shift when I walked in, we were screening ourselves. And I was found to have a fever, and I didn't even know at the time. So I didn't even care for a COVID patient or a suspected COVID patient. And I was told that I needed to go home. And at that very moment, I just felt so guilty that I wasn't able to be with my teammates, coworkers, colleagues. And, that excitement and duty transitioned to fear and anxiety. And I personally did not feel comfortable talking to my family or talking to, I knew that you were going through the same thing, but, I think that we could have probably done a better job with supporting each other in that way and other people who were going through the same thing. So I felt a lot of this common themes that you explained.
That's super interesting. I'm so sorry to hear that you both contracted it. I'm so happy that you appear to have recovered.
Doing well.
Yeah, good. Not everyone can say that, so I'm really happy that that's your story. But yeah, Frankie, what's been your experience as, a frontline worker?
So it's actually very interesting sitting here listening to Jill and Marcus's stories, because I feel like I was going to say the exact same thing. I work at the Hospital of the University of Pennsylvania. I'm an RN there. And my unit was the first unit to become a COVID unit at the hospital. So since March 9th, we've been caring for patients with COVID-19, which has been one of the most stressful experiences I've gone through in my life. But I also tested positive for COVID-19. And I guess about 2 weeks in, and my first gut instinct was guilt. And it wasn't guilt for the community because I knew I was being safe and keeping social distance and quarantining beforehand, but guilt that I wasn't going to be able to be there for the patients. I wasn't going to be able to be there for my coworkers. We talked a lot about community too. And I think such a big part of nursing is the community you create with your coworkers. Nurses go through something I don't think anyone else goes through with your coworkers, and it creates this special bond between everyone. And my instant reaction was guilt that I was not going to be able to be there to help fight alongside them. So very similar experiences for sure.
That's really, one of the things that stands out. Clearly, the three of you have contracted COVID, you've recovered. It's this I can only imagine a very scary thing. And Jill, I think you had mentioned or touched on that there might be a little bit of stigma around contracting it. So there's also that like sense of isolation. And Claire, I would love to hear, you know, what's been your experience with this whole situation that we are finding ourselves in with the pandemic?
Yeah, I also work at the Hospital University of Pennsylvania. I'm Claire. I'm an ICU nurse, and I actually did not, knock on wood, contract COVID. Fingers crossed. I can't even imagine, you know, feeling like you've worked so hard and then, you know, feeling the guilt of not being able to support your peers, which is not the case, by the way. That's not how we feel. But my story, I totally relate with, you know, feeling guilty and not being able to, you know, participate if you're, you know, self-quarantined for 2 weeks. But my story is a little bit different in that I felt guilty sometimes coming into work because sometimes I had this feeling of I don't want to be here because it was really hard for my, you know, for myself from a mental health perspective. You know, you really have to, as a nurse, find strength in really difficult situations. And for me, my situation was a little unique because I was just coming back from maternity leave in March. And all I could think of in my head was this panic of I'm going to bring COVID home to my 3-month-old son and to my husband, and then who's going to be able to take care of them if I can't? And, you know, so piggybacking off of guilt, but not because I wasn't thinking I won't be there for my coworkers, but because of, I was kind of feeling like, why me? Why do I have to go in this situation? Being an ICU nurse, I knew I was going to be taking care of COVID patients all the time, 24/7. And so I think I kind of psyched myself out before I even, you know, got to the COVID ICU units that, you know, I'm definitely going to get it. You know, every day is dangerous for me and woe is me type thing. And I think I realized probably a couple weeks in that, like Frankie said, your team, your nursing team is so important, and you really have to use each other to, you know, find strength and be resilient. And I think one of the things that nurses don't realize is that they have this innate resiliency that we just, you know, it just kind of happens. We don't know. We deal with all sorts of change and we have to adapt every day. And with the COVID situation, we adapted hour by hour. And I think you realize how much you lean on your team members. And that's what I did. So I talked to a lot of people who were sharing the same sentiment that, you know, they were feeling anxious at work. What are they doing with their kids? And, you know, HUP created all of these amazing outlets for us. They got us social workers and licensed professionals for us to talk to. They got an anonymous discussion board up for us so we could have an outlet for our feelings, and, you know, they could help us through the situation. And I think it was just really important for all of the nurses, ICU, COVID, you know, those not working with COVID, to really be there for each other. So my experience was more, you know, drawing on the strength of your team and realizing the resiliency and the strength that you really can, you know, muster up in such a difficult situation.
Okay, that's powerful for so many different reasons. I think that one of the things that really stood out to me about your story, Claire, is that there are new ways that we're finding to be connected, to be there for one another. And, you know, it's a very interesting contrast to the guilt that pops up when you can't be there for one another. So I really appreciate all of you taking the time to join us on this call, to share your stories. I often hear from some of my friends or coworkers, I work in media, that some people don't know anyone who's contracted the virus. So thank you. I'm so happy that you three have recovered and that you are sharing your story. It's important. I think that you're sharing something that sometimes people have not yet had the opportunity to really engage with. So we're about to transition into our next phase of the program, but I definitely wanted to just lob it back to you 4, you 5, one last time, and see if you had any last thoughts based on anything that anyone else shared or anything that you want to leave all of us with.
Yeah, I actually do have a last thought. I mean, this is an incredibly difficult time in this country. We're in the midst of a pandemic. There's inequity, there's racial disparities, there's racism, and it feels very unsettling, very isolating, very painful. But I was listening to these 4 nurses and I was thinking the future's bright. When we have frontline workers, when we have heroes, healthcare heroes like this, I just felt very, very comforted. Hearing their stories were difficult, but they had personally difficult stories, and yet were committed to improving health and really to their communities. So I wanted to end on a positive note because I'm so proud to work with these nurses and with all the nurses and healthcare workers that are part of my community.